To the series of Rare Webinars. I'm Nicola Miller, Creative Director at Rare Revolution magazine, and in the background, as always, is my colleague Becky Pender, who is working on the tech. We're thrilled with such a great turnout today. I think it's a real testament to the subject. So please do use our Q&A function. We're really going to hope to get to as many questions as comments as we can at the end of this session to make it really interactive. So please use that if you think of any questions throughout the session. Today's session, which is in partnership with our very dear friends at Rare Patient Voice, we're really hoping to share the lived experience of caring for and supporting a loved one with a rare disease. And I'm super thrilled to introduce a panel today. Wes Michael, founder and president of Rare Patient Voice, and husband and wife team Celia and James. Celia is an active campaigner for disability policy and rights and lives with the rare disease Marfan syndrome. And James is here today to share his really important insights, because we don't often hear the male perspective in this dynamic as a partner and married caregiver. So hi, everyone. Welcome. And thank you so much for joining us. So
Thank you for having me.
Oh, it's our absolute pleasure. And I always, at the start of every webinar, like to really get to the kind of the crux of it and go back to basics. So I want to start for context with better understanding the role of a caregiver within the construct of a family or close personal relationship. So Wes, I'm going to come to you first, because I know that you've conducted a really important survey at Rare Patient Voice, looking at this dynamic. So can you give us an overview of that survey and what really stood out to you in those results?
Sure. Thanks so much. It's great to be able to show people what we've learned and see how it meshes with their lived experience. We did a survey. This happened to be in the U.S., but in December, of 735 caregivers, family caregivers, not professionals, but caregivers of folks with rare diseases. We screened just on those diseases that were rare. And we asked them all sorts of questions about how it affected them, how it affected them financially and emotionally, and their family situation and their relationship with physicians, and all the tasks and that they do. And then we got a lot of open-end responses too. This was one of those online surveys, but people really took the opportunity to tell us what they were thinking and typed in long things. So we're happy to really get a good feeling for what they said. What stood out to me, and we can go into more as we get into that, but was how much work a caregiver does. We asked the question about tasks. Tasks kind of minimizes what we're talking about, but we gave them a dozen or so tasks, and each one of those tasks is really made up of many more tasks. For example, medication management, housekeeping, meal preparation, transportation. Each of those is made up of lots of different things. And guess what? People are doing on average 8 of those tasks, 8 of those multifunctional tasks. And so they're really taking up, again, I'm not telling people what they don't already know if they're a caregiver, how much this consumes their time and their energy to do all that. So that really stood out to me.
Did you get any insights from that in terms of the impact that was having on the caregivers? Because that's, and I think obviously we'll get to this as we talk through Celia and James's experience, but what's the kind of emotional, physical impact that's having, all of these multiple tasks and areas of responsibility?
Well, emotionally, I mean, yeah, it hits every one of those, but emotionally, it's amazing. People said, and like 3/4 of the caregivers said they experienced anxiety. And caregiver burnout, almost as many, because it's a 24/7. It's no let up, and that's also what they told us. If I could only get some relief, emotional distress, just in general, that 2/3 were experiencing that. Isolated, about half said that depressed. So you got anxiety, you got depression, but less than half said they had sought emotional or help for their emotional issues. So people are suffering, but they're not necessarily getting care for themselves. They're caring for their loved one.
And did you get any insights into what percentage of those people were also working as well as being a sort of full-time caregiver? Was that a big percentage of people?
Well, interesting. I don't recall working, but we found out so many had to stop working or took a lower paying or less stressful or less time commitment job because again, 24 caregiving is of a rare disease can be a 24/7, you know,
Absolutely. So really
job
impacting.
in and of itself. I mean, 63% said they're not as financially well off as they would have been had it not been taken care. I mean, because it affects them in so many ways financially in terms of, you know, not working or working less or having to move to be near a treatment center. All these things affect their education and and the use, you know, their financial well-being in the marketplace, if you will.
Was there anything that came out of that that really surprised you, that was something that wasn't already on your radar as an impact or a sort of narrative?
I mean, yeah, as I say, some things aren't as a surprise, but the numbers behind them become surprising. Like the amount of work everyone does. To me, the financial and the emotional. The other thing that surprised me, I guess, somewhat was how it impacts people dealing with others, the medical community, as well as family and friends. Virtually everybody, well over 80% said, I know more about my loved one's rare disease than my physician. Not necessarily the specialist treating it, but their general family physician. People don't understand because they're tired of explaining it to people. I mean, right? I'm sure the listeners here, they know what I'm talking about, but if you're just an acquaintance, you're saying, "Oh, tell me more," and you that's good, but this is the 400th time you've done that. People had to tell medical professionals that they're wrong. That's not an easy thing to do, and you're not given support necessarily to do that. But about half the people reported that they had to do that, and that almost as many said medical professionals don't believe me. That's the worst, right? You're suffering, your loved one's suffering, and they're telling you you're wrong about something. You're like, no, either you've figured, again,
well, I know for sure Celia's nodding quite
ferociously
that one.
To me, it's like hard. It's hard. It's bad enough to, that somebody is suffering with this rare disease. Is there a treatment? Is there not? Then all this is all on top of it, right?
Yeah. Well, that's the, because that's avoidable, isn't it? That's an avoidable stress that people don't need. So, I mean, that's really insightful. I think it's a lot of it we'd expect to see, but it's just the scale of it, I think, is really impactful for you to capture there for us, Wes. Really important piece of work. So for sure, thank you for doing that. I know there's quite a lot documented, and we talk a lot, don't we? I know certainly a lot of the content that we do in Rare Rev is around that experience of being a parent caregiver. And I think less so about that dynamic when it's a romantic relationship and it's, you're a married couple or life partners. So I'm really pleased that this is something that we're able to shine a light on today, because I think it's just an area where there's much more support needed. I know, James, I could see you were nodding a lot to sort of relating to a lot of the things that Wes said there. So I'm really pleased that we're able to focus on that, not to do away from the parent caregivers, but I think this is an important thing for this space. So Celia, obviously as someone living with a rare and terminal condition, how has it impacted your sort of autonomy, relying on James to be someone that's there for your daily support? What's kind of been that dynamic there for you?
I think when I first met James, like previously in romantic relationships, if you have a long-term health condition or something which has quite a significant impact on your life, the first thing you kind of think is, when do I tell them? When do I have that conversation? And luckily, James and I were friends before we, got together romantically. So he kind of had a little bit of an idea, and I had a feeling tube in my nose, so there was no hiding it. But from the outset, we had that conversation very early on about, things are going to change, and they're going to change very quickly. Obviously, we had no idea how to predict any of what has happened in the last, however many years, and it's been a bit more intense than we thought it was going to be. But it's been very difficult, I think, for us to kind of juggle. And I've always said, husband first, and then you look after me second. There has to be that kind of clear distinction, because you're caring for me from a position of love, but I don't want to turn into kind of a doctor-patient situation. You have to find a way to preserve your relationship around that. But all the things that Wes was saying, we deal with these things really regularly. Last week I was in A&E and I have a feeding tube through my heart. I can't take tablets. and I'd really hurt my back, and James was having to advocate for me just to get a cannula put in so they could give me some IV pain relief, because I wasn't able to advocate for myself in that position. And I'll just do what they tell me to do, because I'm tired, and I will just do what I want to do. But it's very difficult. And, you know, what Wes was saying there as well about jobs, you know, we really have to think about that. James has to be available when I need him. And we had this conversation not 2 days ago, because we're moving house. And the big question is where do we move? Because we can't be too far away from the hospital, and we need to be near my mum and dad so that they can come and help when James isn't around. So I'm very conscious, you know, being in a romantic relationship, the impact that I have on our relationship in, you know, maybe not the best way, in the fact that it influences so much of our decisions. And I have to be very careful with myself not to internalize that like I'm a burden on everybody else. And I think that's something that, especially in a romantic relationship, you really struggle with, because it's not the same as a parent that, you know, have that duty of care, if you like. You know, James could leave whenever he wants to. And so you get that feeling in your mind all the time of, you know, how much of a burden, how much of an influence am I creating? And that is something that, you know, I've definitely broken down quite a few times about.
So how do you cope with that? You know, you mentioned that sort of like husband first, and, you know, obviously when you're in that critical situation, how do you then make that shift from patient mode to wife mode? You know, how do you do that? I mean, and we'll come to James's experience in a minute, but, you know, how do you process that? Have you had support in helping you to make that transition when you're swapping throughout your day like that?
I think it's all about trust, is the fact that so much of our relationship is built on trust, of the fact that I know if I'm not able to advocate for myself, James is able to take control, and I know that he will do it in the way that's best for me, because he understands and he knows me. And, you know, there is nothing private between us. You know, we've been through it all, physically and emotionally. And for me, being able to kind of switch is based on the fact that I know I can trust him. And so when I'm in those moments of, I just need to focus on myself right now, and just focus on, you know, calming myself down, and just focus on the pain, or focus on trying to sleep, or whatever it is, I know that I'm able to kind of flip that switch and say, James, take over, because I trust him. We had an incident where we went to a festival. I don't know why we went to a festival. I'm not exactly a festival goer. And I had a seizure. And because I have a very complicated heart condition, I cannot have the medication that brings you round from a seizure, because it slows your heart rate down. And when I came to, James was having a full-on argument with the paramedic, because he was needle ready to go in at me, and he was advocating for me, saying, please just give her that. And they just wouldn't listen to him. But, you know, that was a real big moment for us, where I knew, you know, I can really trust him, and he's going to have my back when I can't advocate for myself. So that's a big thing, is learning to be able to pass the trust in yourself to advocate for yourself onto somebody else is kind of the biggest piece of advice I would give to somebody.
Thank you. So James, obviously we love you already. More people like this for sure. But obviously, you know, being Celia's life partner, you've had, you know, from the start of your relationship, I assume, a very steep learning curve in terms of understanding what her needs are, so that you can feel empowered to make those decisions on her behalf. So what does that look like for you? You know, how do you feel taking on that responsibility? And then kind of secondary to that, what's that impact on your daily life? You know, I mean, Wes mentioned there about, you know, jobs. Celia mentioned about, you know, where you live and things like that. It's a big question, but, you know, if we break it down in terms of that advocating first, you know, how do you take on that responsibility, and what does that feel like for you taking that on?
Yeah, so I suppose it's because throughout our relationship, obviously the conditions sort of matured, as it were, and has changed. So, you know, some of it we've been learning together. You know, as things happen and new things go on, you know, we have to learn pretty rapidly. But, you know, as Celia said, when we met, you know, I knew that there was a condition there, and you know, it did take quite a lot of learning, some of it quite steep. You know, where I think on our third date or something, Celia had a seizure as well. And luckily her friend was there to sort of help and tell me exactly what to do. And we ended up in hospital again. And, you know, I mean, as you know, being a carer and a husband, I mean, you know, I've always sort of seen the two together, really. You know, I just sort of see it as being a good husband is you know, trying to help out as much as I can with things. In terms of sort of impact on life, you know, it varies massively because, you know, sometimes we have months where everything's sort of going relatively smoothly, and you know, it's just more about routine. You know, which we have to get up at certain times, we have to be back home at certain times, you know, that sort of stuff. And that sort of stuff is much more manageable than when you know, it all goes wrong and you know, something happens. And you know, I've always been quite lucky with employers and the work that I do. You know, it's very flexible hours. It really is very reactive work. And so, you know, if I have to be away for 4 or 5 hours, that's fine, because, you know, I'm sometimes working at, you know, 1 a.m. sat up in bed on the laptop. And that's okay. And so it sort of it works both ways, really. In terms of roles, I mean, I suppose, you know, I to be honest, employers that I've had have been very good about it. You know, there have been a few questions asked, and you know, people, not necessarily the employers themselves, but colleagues sort of, you know, assuming that if I'm working from home for 2 weeks and they say, oh, you know, how was your holiday? And I think it wasn't much of a holiday.
Yeah.
You don't want to explain that, you know, you don't want to explain it. And, you know, I was almost related to, I did say to one of the colleagues about, you know, would you say that, you know, to a mother on maternity leave? You know, how was your holiday? Was it great? And it's like, yeah, okay. Don't quite understand, you know, some of the things that we do. But I mean, in terms of, you know, actually getting jobs, I mean, there's certainly been jobs that I haven't applied for, that, you know, I'm pretty sure that I would get with my experience, or jobs that have been offered that I haven't taken, you know, that require me to be out of the country for certain periods of time, or, you know, are 5 days a week in London. You know, and so there's certainly things I haven't applied for. But as I say, employers on the whole, with me, my experience with it has been that they've been relatively good. So I've been quite lucky in that respect, because I know others, I've heard of other examples that definitely aren't.